Mercy Medical Center wants people to know that a COVID-19 outbreak is not happening at the hospital in Roseburg. But according to the Oregon Health Authority, their data says otherwise.
KEZI 9 News reporter Evita Garza explains why the hospital is now questioning the way OHA is tracking cases.
10 cases. That's how many COVID-19 cases are linked to Mercy Medical Center right now, according to the Oregon Health Authority. And in their eyes, it doesn't matter if the cases are positive, negative, or still presumptive. They still count.
This is what we do for everything. There's nothing special about COVID in this case.
Public Health Officer Bob Dannenhofer says OHA has to count presumptive cases because there's a chance the first test isn't accurate.
We do know that there are some people who test negative for two, test negative on one day, test negative on the next day, and then test positive on the third day that you test them.
Kathleen Nickel, a spokeswoman for the hospital, told me that 8 out of 10 of those cases started out as presumptive and ended up being negative. And one of the 2 positive cases associated with Mercy is from a person who doesn't even work at the hospital. The hospital says they've only had 1 employee test positive for COVID-19, and that person was put into isolation. All other presumptive cases have been negative, but that's not stopping OHA from reporting a workplace outbreak linked to the hospital. Nichols says they've asked OHA several times to remove them from the outbreak list, but the state won't budge. I reached out to OHA and they said they wouldn't comment further on Mercy's situation.
Cases are going to happen. Let's not get freaked out. Mercy's still a safe place to get care.
Regardless, Dannenhofer says there was no exposure to any patients. In Roseburg, Evita Garza, KEZI 9 News.
Well, students